The Healthy Foundation's research unearthed 5 key segments of the population of England. Those that are at the height of health, such as the health-conscious realist, who really is interested in their health. They want to maintain good health and they see it as a way of life. Then they are closely aligned. Their close cousins are the balance compensators. Now, these balance compensators are not as fundamental in their outlook of health as the health-conscious realists. They will have a very good Friday night, lots of wine, lots of delicious food, but then the next day they will sort of, maybe go and have a smoothie first thing in the morning, go for a 5K run. Now, the next segment is sort of in between the socio-economic group. They tend to be younger, tend to be more sort of a student mindset type of person, and they are known as the hedonistic immortals. Now, hedonism is a way of life for them. They enjoy smoking perhaps, they enjoy drinking excessively, but also what we can characterize about this group is that they can give up poor behaviour very easily, almost like that. We then move slightly below this line, the socio-economic line, and we move to a group called the Live for Todays, who represent almost 18% of the population of England. And again, they tend to be slightly younger, but also come from much more deprived communities. As they lead more work-oriented lives, don't find the time anymore to go to the gym or indeed to play football with their friends and so forth. They seem to snap out that sort of healthy activity. And then just below them, at the lowest point in terms of the health behaviour matrix that we've put together are the unconfident fatalists. Now, they are quite fatalistic in their mindset, so they're quite older. They access health services much more frequently, particularly services such as A&E and so forth, even though they know they need to go to their doctor. They're surrounded by people who are also in a similar grouping to them, and also they feel that perhaps if their father or their mother has died of cancer, it's going to happen to them. The balance compensator, if you were to build green fields around them, then basically they would more than likely cycle more regularly. They would partake in more physical activity more regularly as well. Similarly, for the Live for Today, they need support. They need an element of hand-holding in terms of perhaps their journey, in terms of giving up smoking. So they want to try give up smoking. They'll get on with the first couple of days, maybe the third day, but then suddenly they're hit with some sort of crisis. They might be late for a bus or something like that, and then panicking all over. And the first thing they want to do is to reach out for that cigarette. And that's where you need an intervention, perhaps with the support of somebody in the community, a health visitor, or indeed a health trainer, to really sort of, hold their hand, motivate them again to sort of, exercise greater willpower. I think an ageing population is going to be a very difficult sort of proposition for the NHS to deal with, and that's been cited by a number of reports over the last 5 or 6 years. I think in terms of the sort of public health areas which I'm aware of, obesity is a major issue for us to consider, and I think generally the cost of healthcare, whether or not the state will be able to sustain an NHS that is free at the point of treatment any longer, I'm not so sure.